The CDC reports that colonoscopies can find precancerous polyps that can be removed before turning into cancer. Screening also helps find colorectal cancer at an early stage when treatment often leads to a cure. About 9 out of every 10 people whose colorectal cancer is found early and treated are still alive 5 years later. According to the Centers for Disease Control and Prevention, of cancers that affect both men and women, colorectal cancer is now one of the most deadly cancers. Dr. Garth George with Advanced Gastroenterology and Surgery Associates explains how colonoscopies play an important role in early detection.
Colonoscopy screening is extremely important. And I think it's important to note that colon cancer is the second most common cause of cancer death in the country and the third most common cause of cancer in men and women. Most patients are reluctant to have the procedure performed, but it really is a preventable form of cancer, as most cancers are. Colon cancer develops from an ingrowth of the lining of the mucosa, what we call a polyp. And there are certain types of polyps, the ones that are adenomas, that can grow and eventually turn into colon cancer. It's important to note that the adenoma cancer sequence takes approximately 6 to 10 years. So every patient that we see with colon cancer, they've had a polyp growing in them for a long time, which can be prevented because when we do colonoscopies, we remove polyps. Now, of course, there's some colon cancers that may develop a little bit more rapidly, but the average time interval is 6 to 10 years. So it really is a preventable form of cancer. There's no difference between the genders. However, we start on the average risk person. We start screening at the age of 50. And if that person has no polyps, or they have what are called hyperplastic polyps, then the recommended next screening interval is in 10 years. Or if someone has a family history of colon cancer, then we usually start in the 40s or 10 years before the youngest age of the person affected. For instance, if someone has a family member that was diagnosed with colon cancer in their 40s, then that person should start in their 30s. Most patients after the procedure, after having had a colonoscopy, would say it wasn't as bad as I thought. The bad part is the preparation, the day before. Unfortunately, the prep is not tasty. And there's a reason for that. When we cleanse the colon, you lose a lot of electrolytes. So the bad taste in the preparation is really from the electrolyte replacement in the solution. The actual procedure itself is relatively benign. Patients are sedated, either with moderate sedation or some even with general anesthesia. So the vast majority of patients don't recall the procedure or have any problems with it.
For more information on colonoscopies, as well as other treatments and surgical procedures available at AGSA, please click the Important Screening Story Link icon on our homepage at yourhometownhealth.com.